Section 2, hello, my name is Rachel Estep. I'm going to cover the second section on non-emergency transportation. In this section, we're going to cover dialysis patients, wound care patients, and cancer patients. Okay, Section 2, Module 1, we're going to first go over dialysis patients. During your employment with PZ, you will encounter a patient that must receive dialysis. These are some of the most unstable patients you will transport. You must document a clear picture of why this particular patient requires ambulance transportation to and from dialysis. Years from now, this claim will undergo an audit, and we must have all pertinent information as to the patient's condition at the time of transport. It will be difficult for you to remember everything about the trip years from now. Your narrative should have documented why the patient needs an ambulance, either for extreme muscle weakness, oxygen dependency, or some type of medical supervision. By medical supervision, we mean the patient may be a flight risk due to dementia, Alzheimer's disease, or some type of psychiatric disorder. The patient may need medical supervision due to requiring oxygen and they are unable to regulate, or some other type of special needs that may require supervision. Many patients are on oxygen at the home and they have no knowledge of use of the green portable tank. So if this is true, this does justify this patient to go by stretcher due to an EMT needing to be present to adjust their oxygen. Also, be sure to document any pain the patient may have. This is important for billing purposes. Document any type of other pertinent info. For instance, maybe following dialysis, they have low blood pressure, maybe they're experiencing shortness of breath, dizziness, cramps, fatigue, nausea, vomiting, or maybe they've fallen a lot. Many of these patients will complain of cramps or dizziness following dialysis, but the crews fail to document any of this on their run sheet. It's also good to document where the patient was found, their weight, and again, their condition at the time of transport. Patients can improve and decline. If you arrive at a residence and a patient walks and meets you at the front door, they may have improved to a wheelchair status, and this may need to be investigated. You can call or you can email questions@pz.net so we can send a representative to the patient's home to do an evaluation. We have transported patients, and upon arrival to their house, they go get in their front seat of their car and they leave the residence. Again, this type of patient does not need a stretcher, so this situation will need to be reevaluated. Dialysis run sheet example. An 85-year-old female transported from patient residence to dialysis. Patient is alert and oriented ×3, loaded and secured to stretcher ×3, transport uneventful. Some of you may think that this is a great run sheet. Actually, this is horrible. This tells me nothing about the patient at the time of transport. For all I know, the 85-year-old female could be transported in a car. She's walking around. She's perfectly fine. Below, an 85-year-old female transported from a patient residence to dialysis. Patient found in a hospital bed and was sheet lifted to the stretcher. Patient has severe muscle weakness, very frail, weighing approximately 100 pounds. Patient is transported by stretcher due to weakness, stability, and high fall risk. Patient is movable only by stretcher at this time of transport. the history, muscle weakness, non-ambulatory, and chronic renal failure. This is a great narrative. It paints a picture of where the patient's found in a hospital bed. So for some reason, they're not capable of sleeping in a regular bed. It gives me their weight and tells me exactly why they're taken by stretcher due to their weakness, stability, and their very high fall risk. That is what we want to see on your run sheets, not the short 2 sentences above. The end of section 2, module 1.